All right, so we're doing the graft harvesting process for Benny. What I'm doing is I'm taking all the hair from the back of his scalp. Now, this is probably about as difficult as a case gets in terms of hair transplant surgery. So we have a patient who is a TV personality. So obviously all my work is gonna be out there for everybody to see. If you suck, then it's really gonna show. The other thing is he's African-American. African-American hair is very, very coiled, and it's very difficult to extract with the FUE. We're kind of cracking up here because Benny's snoring. He's like knocked out of sleep. He doesn't even know what's going on. And we don't like sedate people, but he just, he's so comfortable that he's sleeping through this. But yeah, his grafts are very coiled, and I'm still using a very small instrument to extract these. Now, that part of the procedure I'm not gonna show because a lot of hair doctors wanna copy me and see what I'm doing, and I'm not gonna show you guys that because it is kind of unique to what I do. But what I also wanna show is is how every one of our grafts come out, which is really based on experience. So we're gonna do it in one clip. We're gonna just do, that's one graft, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So this is 15 grafts. This is not cut or edited or anything like that. We've taken them all out. We have about 100% graft extraction rate. Now here's also what's really tough. You can see that these follicles, what's called splaying, they split out. And that makes it even harder to do because when you make the incision, because these follicles splay like this, it's very common for someone inexperienced to basically transect and cut these follicles. All of these follicles are curved and they're splayed and they're perfect. And this really has to do with the technique of how I do it, and also the instruments that I use, which again is a reason why I'm not showing it, because then a bunch of people will copy it and say that they came up with it. So I wanted to just show this process. This is for African-American hair. This is the hardest type of FUE procedure that can be done, and we do it pretty easily because we do it every day.